Hi, I'm Kaylee Phils, and today we're going to be doing special tests for the elbow. The first test is the valgus stress test, and this test is specifically for the medial collateral ulnar ligament, and a positive test for this would look like laxity when the test is performed. Okay, so for this test, you're going to bring the humerus into slight external rotation. Make sure that the hand is supine. And then you're going to stabilize the elbow and apply force distally outward to see if there's any laxity when this is performed. This next test is the varus stress test, and this tests the opposite side of the valgus. So this is the lateral collateral radius ligament, and same thing, a positive test for this would be laxity when this test is performed. This test will do something very similar. So shoulder in external rotation, arm in external rotation, pronated, but this time you're going to stabilize at the elbow, and instead of pulling towards you, you're going to push away distally to see if there's any laxity. This next test is the lateral pivot shift apprehension test, and this test is for various ligaments in the elbow, and it tests for instability. And one of the positive signs of this test is apprehension. This test, you're gonna have the patient extend their arm above their head, and then you are going to bring their arm forward, and you're gonna bend their elbow and feel for radial relocation or dislocation. This test is the chair sign test, and this tests for any kind of injury to the radial head ligament, and that would be indicated by apprehension when the test is performed. So for this test, you're going to have the patient with their arms back, and then you're going to have them use just their arms to push them out of the chair. This is the Cosen's test, and a positive test for this would be a reproduction of original symptoms, and that would indicate that there is wrist extensor pathology. So for this test, you're going to have the patient with their hand prone and slightly deviated to their radial side. And then you're going to palpate up until their lateral epicondyle. And you're going to stabilize this elbow, and then they are going to resist your hand in wrist extension. This is the elbow flexion test, and for this test we are looking to see if there's entrapment of the ulnar nerve, and if there is, so if the test is positive, we're going to see we're going to have graded paresthesia. For this test, you're going to have the patient fully flex their arm in supination and hold that for 60 seconds, and you'll assess patient comfort levels at 30 and 60 seconds. This test is the lunotriquetral shear test, and this test for wrist instability, and a positive sign for this test is going to be pain, crepitus, or laxity when this test is performed. This test, you are going to have the patient with a slightly flexed elbow and their wrist in neutral. You're going to grab them just above the row or the carpals and place force on the palmar surface, and on the other side you're going to load the pisotriquetral joint, and that will produce a shearing force on the lunotriquetral joint. This test is the ulnar carpal stress test. This tests for ulnar carpal stability, and a positive test for this is going to be a reproduction of symptoms when this test is performed. So for this test, the patient is going to be in 90 degrees of shoulder flexion and 90 degrees of elbow flexion. You're going to cup underneath their elbow. They are going to you're going to cup their hand around the carpal bones, and then they're going to deviate ulnarly. They're going to go into ulnar deviation, and you're going to provide an axial load, and then you're going to passively pronate and supinate their arm. This is Valen's test, PHALEN, and this test is used to diagnose carpal tunnel syndrome, and a positive test for this would be paresthesia when this test is performed. So for this test, the practitioner is going to place the dorsal surfaces of both hands together and have them hold that for about 1 minute and see if there's a reproduction of symptoms or any kind of tingling. This next test is the Finkelstein test, and this test indicates de Quervain syndrome, and a positive test for this would be a reproduction of symptoms when this test is performed. So for this test, you're going to have the patient bring their thumb into their palm, wrap their fingers around it, and then you're going to have them go into ulnar deviation and look for a reproduction of symptoms. For the fingers, we can do a valgus and varus stress test for them as well, now to indicate any collateral ligament pathology. And again, the positive test for this would be laxity. So for this test, if you want to test the valgus stress test, you're going to go outwards at the joint, whatever joint you are testing on the fingers, and then for varus, you're going to go inwards for whatever joint you're testing. This test is the thumb UCL laxity test, and like it suggests, we are looking for possible injury to the UCL, a possible sprain, and a positive test for this would be laxity. You're going to pinch the palmar surface and bring the thumb into extension, and then you are going to provide a valgus stress at the metacarpal phalangeal joint right there. This next test is the trigger finger test, and we are looking for flexor tenosynovitis when we do this test. And a positive test would look like painful nodules or finger locks when this test is performed. This test, you're going to have the patient with their hand supinated. They're going to bring their thumb to the palmar surface, and then they're going to extend their index finger as far as possible.